My name is Shanaé Burch, and I am studying at Teachers College at Columbia University within the Department of Health and Behavior Studies. My focus is in arts participation and cultural engagement and how that impacts health outcomes. I found myself watching shows like Grey's Anatomy and noticing that there were announcements that there were advisors in the writer's room, and that they were applauding that there was medically accurate information in these scenes. And I thought that that was quite cool, and I wondered if it was something that Hollywood was going to start mandating, because people are consuming media and they're making decisions consciously but also unconsciously. And so I was wondering what that might mean for other art spaces like theater, which working as a professional actor, I found that my playwrights were writing stories about health, but they weren't necessarily, the theater companies weren't necessarily partnering with public health professionals in the neighborhood. So I'm getting excited about the potential to really study what are the facilitators and barriers to bringing the arts industry and the health industry together as one. To me, a culture of health fosters listening. I'm maybe a little biased, but I'm really attracted to one of the action areas that discusses fostering cross-sector collaboration. And I find that I have a number of friends who are just waiting to contribute to public health initiatives, but are often told as artists to kind of stay in their lane. And I really want to be a part of disrupting and dismantling that notion. I think we are, as humans, are inherently interdisciplinary, or that we can be. And so that's something that I really want to take into what a culture of health might mean for me when listening to people in these different silos and bringing them together to really make magic creatively. I had the opportunity to attend an early career research network, Arts and Health Intensive. And in the UK, I found myself just marveling at the prospect of what a social prescription program or an arts on prescription program might look like, where people are interacting within the healthcare system and finding that there are untapped community resources that could support someone if they were experiencing social isolation or loneliness. And so I often wonder what types of policies could happen at the organizational level, but then also eventually at the state and aspirationally federal level, of what it might look like for us to formally create a system or network where the social needs of patients can be met, not only through the arts, but culturally responsive care and engagement. Our cohort is made up of 41 scholars, and I found that from the very beginning of introducing myself and my research interests, I was enthusiastically encouraged by my peers to dream bigger, to not just go for the crumbs of academia or of what may only seem possible this week. So how could I make more sense of that? So I initially was saying, okay, well, I'm studying health education and I want to infuse the arts, but I really need to kind of wipe clean my identity as an artist or as a theater maker. And the individuals in our group, even if they don't necessarily identify primarily as an artist, have had so much to say of oh, well, have you seen this musical? Have you read this play? I think, oh, have you heard about this art exhibit? I think that it actually connects with what you're saying. And I'm actually looking forward to really tapping the expertise of my peers when imagining what arts and health programming might look like, specifically looking at people who are looking at racial disparities and homelessness and safety net programs and Social Security and rights of people who are disabled. And I think I am constantly just like having my eyes opened up to the possibilities of how the arts can come alongside my fellow peers.